Your symptoms don't lie, and when Candida overgrows, it sends 5 specific signals, and they show up in places most people would never connect to the same problem. Bloating after meals, brain fog that doesn't lift, itching, bowel movement changes, hypersensitivity, and the list goes on. Most people treat these symptoms separately, and in this video I'm going to show you why that's the wrong frame entirely. I'm Dr. Kenny, root cause health detective and IFM certified functional medicine practitioner. Let's get into it. Before we go through the 5 signals, I want to set up how we think about symptoms in a case like this. When someone comes to me with bloating, brain fog, fatigue, the instinct, both theirs and often their practitioners in this conventional paradigm, is to evaluate each symptom independently. The gut doctor for one thing, the neurologist for another, and the rheumatologist for the body pain. And because each specialist finds nothing definitively wrong in their slice, the person leaves with a handful of partial answers that don't connect. What I'm looking for is whether a set of symptoms shares a common upstream driver, not whether each symptom on its own has its own explanation, but whether they're all speaking the same language. In Candida overgrowth, they often are, and the language they're speaking is terrain disruption and an immune system that's been put on alert and cannot stand down or mount an appropriate response to change it. Here's what I mean by that. When Candida shifts from its harmful yeast form, which is something that's naturally occurring in many of our bodies today, to its more invasive hyphal form, it does 2 things that explain most of one's symptom picture. It produces a toxin called candidialysin that directly damages the gut lining and triggers an inflammatory cascade throughout the body. And it begins competing with and disrupting the good bacterial ecosystem that was keeping your whole system stable when we talk about the gut immune connection. Those 2 mechanisms alone reach into almost every symptom on this list that we're going to talk about. So keep that in mind as we go through them. The first signal is bloating after carbohydrates or sugar. This is perhaps the most recognizable and classic one, and it's also the most commonly misread. Most people understand that Candida and other fungi and yeasts feed on sugar, so they cut out the refined carbs, they feel a bit better, and when they add them back in, the bloating returns. And they've correctly identified a trigger, but they've probably misread what that trigger is actually telling them. The bloating isn't just about feeding Candida more sugar. It's about what the Candida is doing in the gut that's lost its microbial check on that fungal growth. Here's the nuance. Research has found a connection between Candida colonization and the depletion of specific bacteria, the ones that specialize in keeping fermentation patterns stable throughout the gut. That's what leads to the bloating, is extra fermentation. So when those bacteria are gone, Candida fills the vacuum, fills the void, and the result is abnormal fermentation of carbs. And this, of course, results in extra gas production and that bloating that seems wildly disproportionate to what you ate. So the bloating itself isn't necessarily a carbohydrate problem. It's a terrain vacancy problem. The bacteria that should be metabolizing and breaking down those carbohydrates aren't there anymore or as effectively, along with the digestive enzymes that support that process. Candida is filling that role and doing a poor job of it. So the deeper question, which bacteria and why they disappeared, is exactly what the companion video in this series covers, and that's going to be linked at the end below. And by the way, if you are one who likes the research, I've included a free research summary with the citations from this video in plain language with my take on them. So if you want to go deeper on any of these, it's in the pinned comment and the description below. The second signal is brain fog that doesn't lift. And this one surprises people the most because the gut and the brain feel like completely disconnected systems. And yet this is one of the more biologically coherent symptoms in the pattern. When Candida transitions into its more invasive hyphal form and produces the toxin, that toxin doesn't just stay neatly contained in the gut. Research that was published in 2025 confirms that candidialysin directly impairs the gut lining and triggers the release of pro-inflammatory chemicals that travel throughout the body and reach the brain. What this means for you is the brain fog isn't just a brain problem that's isolated. It's likely the downstream effect of a gut problem that has not been connected to it yet. And the result is neuroinflammation. This isn't always the kind that shows up dramatically in lab results or on imaging, but the functional kind that produces what most people describe as this cognitive static that they're living with. Slower processing, difficulty finding words. And this is also why brain fog is one of the first things that people notice improves when their gut terrain shifts in a big way. Not because they took a brain supplement, but because the upstream source of its inflammation changed. Signal number 3 is bowel habit changes. This one presents differently in different people, and that inconsistency makes it sometimes difficult to target, but it's actually part of what makes it useful clinically as well. Some people with Candida overgrowth develop loose bowel movements or diarrhea, and others develop constipation. Some even alternate between the two. And because those seem like opposite problems, people rarely connect them to the same underlying issue. Here's what's actually happening. Most people don't realize that about 90% of your body's serotonin is produced in the gut wall, not in the brain. Serotonin is one of those primary regulators of how quickly food moves through your intestines as well. Candida overgrowth has been linked to changes in that serotonin production. Too little motility and the movement of your food through your gut, and you get constipation. Disrupted motility signals, and that pattern becomes more erratic. What makes this a terrain signal rather than an isolated gut issue is the timing. In Candida-involved cases, many of the times, bowel changes tend to correlate with dietary shifts, stressful periods in life, or antibiotic courses. If your bowel pattern changed noticeably around any of these points, that context matters more than any symptom in isolation. Signal number 4 is persistent itching. And this one is quite blunt clinically, and it's worth saying quite plainly. But persistent anal or vaginal itching, explained by a local infection that's been properly tested for, is one of the more specific signals for fungal overgrowth in the gut ecosystem and beyond. It's not universal. It's not diagnostic on its own either, but specific enough to take seriously, especially when it clusters with some of the other symptoms in this video. What's happening mechanically is that Candida, particularly in its hyphal form, can colonize your mucosal surfaces, and these are the moist tissues that line your gut, digestive tract, and other tissues as well. And when you're attempting to treat these areas topically and they don't resolve predictably, this is a good sign that the source is more internal, not local. And this is why someone can use an antifungal cream, clear the local symptoms maybe temporarily, and then have them return within a few weeks again. Classic. Treating the surface without addressing the internal terrain is the common theme between all of these. Signal number 5 is fatigue and exercise intolerance. This is the symptom that often gets the most dismissal because it's vague, it doesn't really have a name, and it doesn't show up on standard labs, something that you can look for. People describe it as feeling like they're moving through molasses or resistance, or waking up unrefreshed, hitting a wall with activity that it used to be able to do that seemed more appropriate for their fitness level. In functional medicine, when I see this clustering with the other 4 symptoms on this list, I'm thinking about immune system activation and changes, the body's defense system running at an elevated cost, and the energy demand that is placed on a system that is devoting more energy resources to dealing with this overload from Candida and its related toxins, as well as its direct immune suppression. When Candida lysin breaches your gut lining and triggers this inflammatory response throughout the body, those inflammatory signals place a continuous energetic demand on your immune system. Your cells have to choose between fighting and fueling or repairing. And in that choice, your performance often loses. And that manifests as the fatigue and the exercise intolerance, or the body that seems to be working harder than your circumstances warrant. The research summary also covers this mechanism on Candida lysin in more detail. If you want to bring that into your awareness, it's in the pinned comment and the description below. So here's what connects all 5 of these at the root level: the bloating, the brain fog, the bowel changes, persistent itching, and the fatigue. Individually, each one of these has a plausible alternative explanation, and often hundreds of other explanations. Together, and especially if they cluster around certain histories, the antibiotic piece, the blood sugar piece, carbs, they are pointing at something more systemic and lasting. They are not 5 separate problems. They are a terrain conversation expressing itself in 5 different ways. And understanding what creates this terrain condition that allowed the shift to happen in the first place, why Candida keeps coming back even after treatment, that's exactly what this companion video goes over here, so check it out. I'm Dr. Kenny, Root Cause Health Detective. Thank you for watching, and I'll see you in the next one.